So that would keep our holdings, I believe, at about 1.4% of our total portfolio, which isn't a huge holding in this company, but just kind of with the political climate and everything right now, we don't feel that taking a huge share in a healthcare company would be beneficial to the portfolio right now. We want to keep it kind of on the lower side.
I think that's all the questions I had.
Yeah, I have one. So, you guys mentioned how Verb is coming in with Alphabet and Johnson, and then you guys said that this year they're just kind of starting to test their products and services. But that sounds like within a year or two, maybe 3 years, they'd be legit competitors. And any company like Alphabet, it kind of just makes me a little nervous if they're going to be your direct competitors. So, could you guys maybe reiterate a little bit like how you're going to compete with that?
Sure. So this is the oldest robotic surgery company, and these kind of companies require a lot of research and a lot of trust. And so not only are they built on the quality of their company and their current installed base, they rely on that whole body of research. We're talking about 21,000 peer-reviewed articles and a lot of experience in the market. And so for a new company to enter the market, sure, I mean, those are huge companies, but they're really going to have to prove that their product works. And it's going to take more than 1 year. It's probably going to take more than 5 years. So they need to develop the product, get it approved, and then allow research to be done on it. And that's what they're doing right now. They're gathering data. It's a long process. And another thing is that the surgeons are trained on this platform. They have to learn a new platform when a competitor comes in. And that's a really big deal. It takes a long time to learn how to use these systems. We have the whole training and analytics and data gathering on lock right now.
And beyond like trying to develop a supply chain that can compete with this company, Verb really doesn't focus too much on emerging markets to where that's what this company does, especially with the new lease programs. So it would almost, they focus more on like the developed, trying to get involved there, to where we have a lot of all over the world countries on lease programs that might not be able to afford the equipment.
Okay, so since this kind of more trend towards robotics in the healthcare sector, this trend, what is the industry response to this disruption? What do the surgeons think about having their, I guess, job taken away or whatever?
So, just from what I've read doing research for this company, a lot of surgeons like this particular model just because there's simulation and there's VR training. A lot of the companies that try to get involved in robotics don't provide adequate training for their surgeons, and that's where you see a lot of the disconnection. But just the fact that this company has it has facilities all over to train people, and then they also have, when we went through the sales, they actually have people that they station in the hospitals to teach the surgeons and get the ones that are interested. So by all means, when it's minimally invasive surgery is only 2% of surgeries and it's growing at 8% every year. We're not like taking the surgeon's job necessarily very significantly, but there's definitely a good response with the training that's provided through this program.
And then, another kind of similar question, with the minimally invasive surgeries only being 2% of surgeries, even though it has a high growth, it's still a small percent.
Yeah.
So, do you see the importance of the minimally invasive, like in the context of all surgeries? Is that a high enough percent to make anything worthwhile?
We were really happy with the growth rate of 8% annually over the year. So if we're 2%, we're growing 8%. That's pretty significant. And then again, like we only have 5,500 systems worldwide. So we really, the more that goes up, the more our infrastructure is going to grow. So
These are installed base systems that trade their old products in for new products and earn reoccurring revenue. I found a picture of a surgeon operating the machine. You asked about it taking the surgeon's job. So I found a picture here of the surgeon. Excellent job. Yeah.
One more question, then we gotta cut it.
So
Scully is the primary manufacturer for the company?
So for their endoscopes, and a lot of their visualization products, they are. So they were the main supplier of those products to ISRG. And then they bought 2 properties in one manufacturing plant, with one being in the United States and the plant and another property being in Germany. So they're manufacturing more in-house, but they still have a great relationship and they're still supplying tons of stuff.
Okay.
Alright.